Hi, my name is Dr. Sean Lordan. I own Concierge Physical Therapy. We have three locations in the area in Sutton, Shrewsbury, and Hopkinton. And I wanted to just take a moment today to talk about Shockwave Therapy and how it's been helping our patients. We've now invested in a Shockwave machine at each of our three clinics, and we've found it's made a tremendous difference uh, in the healing processes of chronic pain and tendonitis and tendinopathies. And it's really just a great, safe um, alternative medicine to anything injectable or surgery. And it's really tremendous when combined with other great care, like seeing your podiatrist and going to physical therapy. Just want to touch on exactly how it works and what we've seen it really be successful with for the rest of the body. Um, I know uh, Dr. Pelto, Savian, and Feldman use it for the lower body with great efficacy and great success. So I won't talk about the plantar fasciitis and Achilles tendinopathy and other diagnoses that it really treats well in the lower extremity. But I do want to touch on the upper extremity and the hips. Shockwave in general is they're sound waves that go into the tissue and basically regenerate and create a healing process in the muscles, right? I've been fortunate enough to be able to do this over the last several years and really trial it in all parts of the body. So where I find Shockwave to be truly effective is for those with tennis elbow. So any pain in the elbow on the inside or the outside, folks with rotator cuff tendinopathy or any calcifications in the joint or the muscle tissue. Those with just tight muscles, so like tight upper traps and the tight mid back, where you're kind of just like getting stiff with age, as we always do. I see all these stretching classes pop up, and I think to myself, I'm like, oh my goodness, if they just knew about Shockwave, they would just get Shockwave and then do the stretching, and the results would be that much better. We're seeing Shockwave, more and more become more and more prevalent in medicine today, and you know, it's just a tremendous way to improve not only tissue healing, but tissue length and tissue quality, right? So again, Shockwave works best. So we do it, let me just talk about, we do it once a week for at least 3 weeks. Some, folks who've been suffering for a while, sometimes it may take more than once a week for 3 weeks. It might take, 6+ sessions, but typically for chronic symptoms and pain, it's anywhere from 3 to 6 sessions that we see the shockwave be efficacious, and really the result is a reduction in pain, right? Because that's what we're looking for. Uh, what we're seeing overall over the whole body is about an 80% reduction in pain score. So if you said, "Hey, Dr. Sean, I'm coming in and I have a 8 out of 10 pain in my elbow," I say, "Okay, well that's great. We're going to do PT. We're going to do Shockwave once a week for 3 weeks." After those 3 weeks, really, I usually do it at week 4 because that's when we do our progress notes. After a month, I ask you the same thing: zero to 100% or 0 to 10. 0 to 100%, how are you feeling? And then 0 to 10, what's your pain? Typically we're seeing my pain is much improved. It's 3 out of 10, it's 2 out of 10. And again, we're combining that with excellent PT as well. But Shockwave can also be done as a standalone. Just in my opinion, it's not as effective. Just wanted to kind of give you, a little spiel on how it can be done successfully in other parts of the body. We're seeing it really do a great job for quadriceps tendonitis and tendinopathy, patellar tendinopathy. We're getting a lot of referrals for hip pain, for glute med tendinopathy, and piriformis syndrome. And for the low back, it's hit or miss. The jury's kind of out on the low back, but it is really super efficacious in the elbow, the shoulder, the neck, and really the other joints. So that's my couple minute spiel on Shockwave. And hopefully, please feel free to reach out if you feel as though you'd like either a trial of it or I can answer any questions for you. Thanks so much.